Thanks for joining us. We're having a conversation with my two favorite scientific directors. I don't think I told you that, but Burton Earnshaw at Valence Labs and then Yoshua Bengio here at Mila. And we're having it here at the offices of Valence Labs in Mila. So it's quite appropriate. So yeah, let's just dive in and start talking. One thing I've been telling the teams, and actually publicly, that to win in AI drug discovery, it boils down to three components. Compute, data, and people. Sounds very simple on the outset, and admittedly it is, but it's really like the implementation details that matter, like how to execute that strategy.
Yeah, I would add something.
Okay, a fourth one?
So how do you get people to do the discoveries that matter to you at least, right? I mean, to your goals.
That sounds like a people problem.
It is a people problem. And in my career, I've seen different patterns in industry and academia, and I think that the sort of what seems to work is a portfolio of different horizons of bets. There are things we can do with the current technology and maybe epsilon improvements that are low risk in terms of research, and are almost certainly going to give us some advantage in making the biological experimentation more efficient, like active learning. And then if I go to the other extreme, I have a very strong belief that we are on a trajectory to build the tools to do as well as human scientists or better. In particular, better because, like, even if we didn't find new principles of intelligence that beyond human, better because human brains can't absorb a billion data points, especially of something that is not naturally intuitive to us, like not images, but millions of images of things that are not in our like day-to-day things like cells, but also all kinds of other measurements that we're not really equipped to handle. And although we can generate scientific hypotheses like biologists normally do, for example about pathways, it's hard for us, for individual humans, to create a systematic map of the different possible interpretations, theories. I mean, the whole scientific community, in a way, is doing something like this, but it's very difficult for individual humans alone.
To like maintain that entire context at once.
Yes, of all the hypotheses that compete with each other on different parts of the set of questions we're interested in. And why this is important is because that whole like uncertainty, which is really complex because many possible hypotheses can be more or less compatible with each other, that is what should drive efficient experimentation. What I'm trying to say is that computers can do the scientific work in a much more systematic and large-scale way than brains, like single brains or like teams of researchers could do. And so bottom line, there's really an opportunity, in my opinion, to do a lot better than what a team of humans would do. A team of like traditional scientists doing, say, drug discovery. Like what I'm saying, the whole pharmaceutical industry already believes, but that's why they're investing. But I think there's a reason. It's not just that it's cool and exciting and fancy. It's because you can see how, say, GPT-4 is able to bring together an amount of information from all of the corpus that it's trained on. That's way beyond what a single human can do.
Right.
Now, of course, you could have 10,000 humans trying to form a big committee and answering the same questions, but you can see how inefficient it gets.
So you said like, originally you said there was this people challenge of like directing the research to get to that endpoint, right?
Yes.
So what were you saying?
So what I was trying to say about this is you also need to make the longer term bets.
Yeah.
Because the like return on investment is potentially huge there. And there's a good chance that within on the order of a decade, we'll figure out how to do these things with AI, and it's going to completely transform society and scientific research. So being at the forefront of such a high level of transformation will be highly valuable, of course.
The way that we're addressing that at Valence Labs is that we have established a 10-year mission and vision. I say 10 years because that's a long ways off.
Which is the autonomous, scientific discovery.
Yeah, which is
mission.
what you've just been talking about. Is the mission statement is industrialized scientific discovery for radically improving patient lives. Scientific discovery more broadly, I think, there's a possibility here as well to have to develop as part of this program the methods and the tools and the kinds of algorithms one would need to start with any kinds of data sets and drive efficient, valuable discovery, again within the constrained budgets we have for running experiments of different kinds.
Maybe to go further in that direction and connecting with what I said earlier about systematic management of all that information. A single human scientist can be really good at designing an experiment where you are only considering a few choices.
Right.
But there's no way like a normal human brain can handle, okay, tell me what is the next batch of 20,000 experiments that I'm going to do. And you only have an hour to figure it out.
Right. Yeah, right. And you have to optimize amongst all these other operational constraints.
And this sort of gets distributed across lots of scientific labs and and scientists, right? Like lots of people working, writing in parallel on similar systems, publishing, going to conferences, we're kind of aggregating that information.
With a very long lag of information.
With a very long lag as a result.
Yes.
And what we're talking about here is sort of the same kind of discovery, but having that all being coordinated in one
I think the
system.
term industrialization of scientific discovery is a good choice of words.
Yeah. This it may not be the way that it was described when like Recursion was first thinking about what data it ought to generate, but one of the primary reasons it went after images of cells and using modern machine learning to create descriptions of morphology that go beyond our ability to just handcraft
handcrafted features
is because we expect there to be a lot of information that we do not have the language to properly talk about, but that nonetheless give us insight and allow us to generate therapeutic hypotheses about the biology that we're observing. And I think that's a primary example of kind of what I was talking about earlier, where we need the ability to generate these kinds of data. So did I mention that those are cheap data sets to produce? I mean, like that's, we only have so much money and like the budgets are finite, right? So the more of these kinds of things that we have that we can integrate, in this kind of multimodal, and in biology, this kind of multi-omic way, the more we're going to be able to do like the kinds of things that we've been talking about.
Yeah. That's it's going to be hybrid in some ways.
It is.
And facing both the computational budget constraints and the experimental budget constraints.
I actually want to talk about compute because that's like the final thing. So if you recall, like in 2020, 2021, we invested in a supercomputer. And at the time you said that's a good part of any good AI strategy. And since then, like we most recently announced we're like 4 timesing that with the 500 new H100s. Do you see any line of sight of the need of compute going down? That was great.
Like the other way around?
The other way around. So like, explain that, because like if we have all these foundation models that can create all these amazing representations and it's trained on large data sets, and that's where a lot of the compute takes. Like we are hopefully getting to the point where we're more data efficient, and I would hope more compute efficient as well. And I'm somewhat playing the devil's advocate because I feel like I'm just curious.
So part of the causality research program that is very active here but also in the broader scientific community,
Mm-hmm.
is that it has a promise of doing much more simple, efficient learning. In other words, that we can get away with models that need less data and less compute. And the reason has to do with two aspects. One is it's a model-based. In other words, we're able to put more constraints to focus directly on the small description length explanations for the data, and use like biological domain knowledge more directly and explicitly. And the other is because it's a model. It's a probabilistic model that relates all the variables of interest. And the other reason why we expect that it's going to be more simple efficient is because it's a causal model. So what does it mean? It means that the same parameters can be a good description under a vast diversity of interventions, of experiments, which is not a given usually in machine learning. You train on some range of conditions, and it's not at all sure that you're going to extrapolate correctly in a very different kind of interventions. And we know that the correct causal model has this incredible power of generalization. And we know that human brains exploit that quite a lot. In fact, we know that when humans are able to make very powerful out of distribution correct predictions, it's almost always in cases where we use our system to, like we consciously call upon our causal understanding, and that if we just go by our like system one, like habit, like my first intuitive response, I'm not that great out of distribution. And so there's evidence that this causal way of capturing dependencies buys the ability to generalize better in new cases. And of course, in medicine and biology, this is very important because we can't have a sort of uniform coverage of the different experimental settings. And things will evolve. They're all the setting. For example, one really important reason is that the set of context in which you can do experiments is a far cry from the real world of the body of a person, right?
Yep.
So how can we hope that the experiments we're doing there tell us about what is going on here? Well, that's where being causal gives you an advantage. And now, how does that translate into computational costs? I think there's a clear translation in terms of sample efficiency. And there are good reasons to think that in general, sample efficiency and computational cost, like how big of a neural net do I need, they're related. So if you think about it, if I'm going to represent a very complicated distribution, or a very complicated function rather, I'm going to need a lot of data to learn that function. Well, vice versa, if the function I'm going to learn requires less data because somehow it's constructed in a beta way, well, probably means the function itself is simpler, like it has less computations that are needed. So we can anticipate that when we crack the causal discovery algorithms, we'll win both on the generalizability of the conclusions we get and on the computational cost of building these models, of learning these models. But these are speculations, we haven't done it. At least they could be thought as motivations. But I think the more important motivation isn't the computational costs, is this going to work on the patients, right? So, and that's a generalization issue.
Right.
Well, you had already given your 10-year horizon of autonomous AI scientist.
Let's go to the short term.
What's the short term like? And I'll ask both of you the question what do you see in the next 5 years, and what do you see in the next 1 year?
Right. So there are already a lot of things we can do with the techniques that are already published, and that we need to do the right engineering to exploit. So if you think about active learning methods, GFlow nets, supervised learning predictors of the outcomes of experiments. So these are all building blocks we already know the science of, but we can do better in engineering these things for solving the problems that matter to you. So for example, we were discussing through a document the question of constraints of the experimental setup.
Right.
Oh yeah.
That you can't do like an arbitrary sequence of experiments. It's going to be a lot more expensive if you do that than if you're able to group the experiments
and batch them
batch them in the right way that corresponds to what the actual physical, biological setup looks like. So that, of course, isn't in the papers that already exist about these active learning or GFlow-Nets methods.
Right.
But it seems very plausible that we can do what a lot of machine learning papers are about, like take specifics of the problem you're trying to solve, take the principles that exist.
Yep.
Okay, so how do we constrain the action space, for example, of the thing that proposes experiments, so that it's going to be constrained to within, basically, okay, I need to choose batches that have these degrees of freedom. So now I'll just choose these degrees of freedom. But for any choice I make, it's going to be batched.
Right.
So that sort of thing requires thinking, but not new breakthroughs.
Right.
The sort of thing you could do, next year, 2 years from now. And there's an infinite supply of things like this we could do.
The CTO says.
Yes, this year.
This year.
Yes.
No, but there will be other things that we didn't think about next year,
sure.
where we can build on whatever is current state of the art.
Yeah. That was my 1 year as well.
Okay.
It was literally, I think, and we were already seeing it in papers that are being published and by our group and other groups that we're really taking the existing tools of things like active learning, like an optimal experiment design. We're taking those tools and we're applying them to real world laboratories and experimental setups and seeing gains, massive gains in terms of being able to predict, essentially the outcome of experiments with far less data than, say, just generating the whole of it. That is a really powerful concept that we know we can do, and we're working hard to make part of just our typical everyday workflows. And as we continue to produce gains in that way, I think we're going to see, again, come back to these virtuous cycles, just going to see a lot of capacity, budgets being able to be redirected towards either creating new and exciting data that's really rich in information in the sense of being like in addition to what we've already generated in the past, and is really going to take us in directions that will I think be very new for people working in this area. Like we'll be exploring biology that really hasn't been explored before because we haven't had like the experimental setups and the machine learning kind of married together in a way that would allow us to really exploit that cycle.
Yeah, and there's a more prosaic version of this, which is, let's say we only get a twofold improvement in the efficiency of the exploration. Well, that means we just reduce the cost of the experiments by a factor 2.
But yeah.
How much money is worth?
You can buy a lot of GPUs with that.
That's a lot of GPUs and a lot of machine learning researchers. So I think these things are going to pay for themselves pretty quickly.
Drugs go into the clinic and fail at a rate of greater than 90%. We often talk like if you could just get that to 80%, it's a huge gain. And if you can keep pushing that failure rate down, massive gains, especially for the patient populations that we intend to benefit. So it's all really exciting to think about. And I know the momentum is already in that direction. We're seeing the gains. It's just in a year we're gonna be able to really talk about what those gains are.
And as an organization, like what type of principles or practices do you think every organization working in AI should have to be a good citizen?
In a way, it's similar to what ethics review that is already happening in general in biology, medicine, and other areas, but is completely lacking in AI. Now we have to bring in the AI component. How does that change the question of what can go wrong, or how can that be misused, and so on? And the lesson from now decades of biologists doing this sort of thing is you need to have a process. You need to have people independent from those who do the work because they're biased.
Yep, they want to see
They
the
want to
work.
see the good side of
Yeah,
things.
Yep.
You want people who are not doing the experiments, have no stake in the game, to be able to read that science before it's divulged and say, have you thought about this? Or, have you put some guardrails this way or that way? And be able to report to higher level authorities, some board or whatever, within the organization that should be a watchdog for these things.
I know you saw a number of committees here, like in Canada, but also like you spoke to the U.S. Senate. Like,
Yeah.
any takeaways from those conversations with respect to biology? Like,
Well, yeah, I mean, biological risk is one of the things that governments really worry about, and I think that companies like Recursion will be contacted by if not already the case,
Right.
so that they collaborate with governments on this. Not all of it being in the open, for obvious reasons. And I think that another aspect is they might not have all the expertise that you have. So you should also think about, well, how can we help the government do a good job there? So it's not just what you can do, but the expertise you have in the hands of people in government worrying about this can be useful in the context of they maybe setting up rules that will apply to all biotechs, for example. And of course, I think you should have a vested interest
and manufacturers too.
and
right?
manufacturers,
Yep.
and you should have a vested interest in influencing that process in a honest way, because you want the rules that government will come up with to be applicable, to be realistic, and provide safety.
Yeah. All right. Well, thank you.
Pleasure.